Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Before we get started on the program, let me say that I've been here. I came here in 1958 as a medical student, and but I was only a child. And I'm still here at Downstate Medical Center because it's a center that has proven itself to be so important in this community as such. Oftentimes, politics gets in the way, finances get in the way. However, nothing can ever stay out of the way if you need a hospital. You need a hospital in your community. We do not have the adequate facilities appropriate for the number of people that keep coming into New York or Brooklyn as such, where we have a high incidence of AIDS and a lot of other things that are chronic diseases. And so we expect you who are out there to pay attention to what's happening to your medical facilities, and don't stay home and look at television at riots or people marching around a hospital and not do anything about it. We need this hospital, Downstate Medical Center. All right, now getting into a very important subject today, we're going to talk about a little bit about men's health. Men's health is such an important subject. Men die earlier than women. Yeah, that's right. Women live longer than men. That's why you see so many widows, in a sense. What's the difference? Is there genes that makes women live longer, or is it what we do as men make us live longer? In some cultures, you're not a man until you take your first drink of alcohol, and maybe take a cigarette. That's considering going from a boyhood to a manhood, which is really sad when you think about it, because those two things are detrimental to the body, and if you start them early enough, they become addictive, as nicotine can, and alcoholism or such. And so for many ways, alcohol ends life early because of automobile accidents and things like this, and working on jobs where you can't tolerate the work because you're an alcoholic and things like this. So men's health is very important, that we keep the men, you out there looking at this. If you have a husband or a significant other, bring them to the television set right now, and so you won't have to tell them. They'll take our lead or why they should be concerned about their health. Today we're going to talk about certain conditions, prostate gland being one of them. There's a Moms Mabley, she was a comedian, and she said one day she went to the church, and she said when the plate came by to collect the money, she took a $100 bill and she held it up so the minister could see it, and it floated down in the plate. And at the end of the service, the minister looked at her. He said, "I saw that benevolent old woman take that $100 bill and float it down into the plate. God bless you. You're going to live for many things." He said, "But because I love what you did, you can have any him you want." She said, "I want him, 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 and especially you." So let me say this. There's a difference between H-I-M and H-Y-M-N. Now, the other thing is in church you sing, "All hail the power of Jesus' name, let angels prostrate fall. Bring forth the royal diadem and bless all." The prostate that you're talking about is prostrate, P-R-O-S-T-R-A-T-E, prostrate. So don't call it gland the next time you see your doctor the prostrate gland. It's prostate, P-R-O-S-T-A-T-E. Leave the R out. It's not prostrate. Prostrate is bending down. But anyhow, we have Dr. Sadowski with us today to talk about the prostate, S-P-R-O-S-T-A-T-E gland. And I'll bow down to you and let you talk in a prostrate position.
Well, it's a pleasure to be here. And actually, the prostate gland is very important to men. And actually, it's one of the major reasons why men come into the doctor's offices. And it's the part of a man that is most likely to give him symptoms that concern him.
Right.
The prostate gland is actually located at the base of the penis.
Right.
And through it travels the urethra, which is the tube that carries the urine.
Right.
So the prostate surrounds that tube, and if the prostate starts to grow, it can impinge on the tube and cause changes in both urinary activity
Right.
as well as sexual activity.
Surely.
So the prostate gland can do things that really affect a man's here and now.
Right.
Because that's an area that men are very concerned about, the groin. And as you know, Jerry, it's very hard to get men to come to the doctor's offices. And this is one of the problems that does get them to come to the office.
Surely. Well, the prostate has other functions also. From the standpoint of producing the semen and things like this, where when you have ejaculation or when the sperm comes along, it has to have mobility, and so the prostate also is involved in this. And the thing is that we didn't pay much attention years ago to the prostate gland, and you wonder what took place 50 years ago or 40 years ago, because I can't think of my father having thought of prostate, or my grandfather. So what time do you think in history that this started playing a role from the standpoint of being an important gland, from the standpoint of cancer, things like that?
Yeah, I think that's a good question. It's probably about 20 or 25 years ago.
Right.
I think 50 years ago we were concerned with major advances having to do with infectious diseases and
Right.
heart disease and things of that nature. So we were really bound up with the issues that caused mortality in
Right.
men, things
Yes.
that killed men.
Like heart attacks,
Right.
things like this.
About 20 or 25 years ago, men started to think more about quality of life issues.
Actually.
Things that were affecting their lives. 50 years ago, our fathers never thought of complaining if they had to urinate frequently, or if they had to wake up in the middle of the night. That was a normal thing that occurred as we aged.
That's right.
So you would just get up and you'd urinate and you'd come back to bed and you'd try and go to sleep.
Or keep a urinal
as best as
beside your
possible.
bed.
Yeah, that's another way of handling it.
Actually,
But I think now in the last 25 years,
Right.
now that we've had some advances in dealing with some of these more major morbid medical problems, again, like heart disease, and pulmonary disease, and we have treatments and we have pathways, men are being more concerned about their quality of life. I think also the introduction of medications for sexual activity, with the advent of Viagra, the development of Viagra being released by the FDA in 1998,
Surely.
and during the few years that preceded that, we started to get very interested in male sexual function.
Actually.
So actually male health became in existence at that
Right.
time and comprised of prostate,
Right.
causing urinary symptoms, and other sexual dysfunctions, some caused by the prostate and some caused by testosterone.
Well, it's really interesting. Again, our diet has changed too. The lack of, or the not producing certain things in our body to keep the prostate gland from growing and so forth. Seemingly, the male has a balance between female hormones and male hormones, estrogen and the testosterone. Testosterone definitely increases the size of the prostate. We know that. However, and I hear on the air right now, to increase your availability of sexual activity, we have testosterone products being offered to men by male. Saying that this is the best thing that could ever happen to you in life if you live long enough to enjoy sex and things like this. So I'm thinking of all this testosterone products and things like this. But more than that, I'm thinking also of things that are interfering with the female hormone. Seemingly, the estrogens that men have as well keeps the gland in check to a certain degree, and that they're finding certain things that men do, even in beverages such as beer. Now, if you take beer has they think has certain things in it that decreases the production of estrogen, which is interesting because if you have a balance of estrogen and the testosterone, and you decrease one and let the other one start working. So what I'm trying to say is that we have not found really that true thing of diet, what diet is doing to our prostate gland.
Right, and this balance is really very important,
Very
because estrogen is not only important because of how it balances the prostate,
Sure.
but it's thought that if you decrease the estrogen level in a man, you're going to increase his cardiovascular risk. And maybe the presence of estrogen is one of the advantages that women have that help them to live longer.
Isn't that interesting?
We also know that the presence of estrogen and its metabolites also help to keep bones strong.
Yes, right, surely.
So if you decrease the estrogen levels in men, then you have a matter of concern. Now, we're learning a lot more about testosterone administration these days.
Sure.
And that's a whole nother topic.
Oh, yeah, surely.
And how it affects the prostate is very important.
Surely.
It looks as though testosterone will increase the size of the prostate.
Surely.
So if you have a man who already has symptoms of what we used to call prostatism or benign prostatic hypertrophy,
Surely.
if you have those symptoms, then taking testosterone is likely to make those symptoms worse.
That's right. Surely.
Now, it's up to the man and the doctor to decide, is it worth it?
That's right.
Is taking the testosterone giving me a little more energy, helping me lose some weight, maybe improving my libido a little bit?
Yeah.
Is that worth the potential penalty of an enlarged prostate and further urinary tract annoying symptoms?
Right, surely.
Well, this is something we each have to discuss with our own physician and find out whether it's worthwhile.
But you know, a lot of physicians don't go to courses as they're given in medical schools and hospitals. They're so busy in the office, little time do they spend in their journals or going to conferences. And that's why we have certain kind of credits we give doctors who do go to these courses. And I think that it would be very important that a patient almost know what courses a doctor has taken before they start talking, you know, because most of the stuff is brought in on the radio and television. And the radio and television plays a major role in your direction of your diet, what you're eating, what you're not eating, and things like this, you know. And so I really find that doctors are not keeping up with the education. You know?
There's no doubt about that. Now education for doctors is becoming available through websites in small bites. As a matter of fact, I looked at a website for doctors recently that has little educational programs that are as short as 2 to 10 minutes on topics like what's new in treatment of hypertension and what's new in treatment of benign prostatic hypertrophy. Now if you're an interested patient, you can join these sites. And some of them are still being offered for free. And you can look elsewhere to try and get education. So no doubt consumers should be more educated and intelligent about what they're doing, because there's an awful lot for doctors to know.
Oh yes, in fact, you know, believe it or not, there has never been a black doctor on television, male black doctor on television in the United States. The first one appeared there was myself on the McCreary Report on Channel 5. And that was Bill McCreary, because I was on Black News with him. And when he was promoted to another position in Channel 5, he brought me along the McCreary Report, and I did the health thing on the McCreary Report for close to 10 years, from 87 to 97. But since my time, there's not been a black physician on major television, male. This is real. They have Dr. Oz now, they have all these other doctors, the young doctors.
I've seen the panel.
Like they know it all at their age. They haven't got their feet wet yet. They got a lot of book stuff, and they got a lot of, but they're following patterns, you know, what's being presented in certain journals, and if it agrees with them, they keep promoting that, you know.
Sure, and this idea of physicians who sort of just follow old rules and old thinking, you know, sort of brings us around to the fact that this is now, you know, prostate month, you know, going on right now. And one of the ways of prostate screening, especially for cancer, but also for enlarged prostates, is a blood test called PSA, or prostate-specific antigen. And our thinking about that is evolving also. But I think many of your listeners may have the opportunity to get a prostate checkup during this month. I know there are lots of places where Downstate is doing it, and other hospitals are also participating.
Well, I think that one of the things that drives men away from this is the rectal examination. But the rectal examination, like a vaginal examination in a woman, for example, is no different. The rectum is a very sensitive organ. As I was talking before, it can tell the difference between liquids, gas, or solid. And just imagine if you have gas and you expel gas, and the kids would say fart, as such, you pass gas. But you don't make a mistake if it's liquid. because you know that liquid will come out at that particular time. And the rectal organ is so sensitive, it can tell the difference whether that's gas, liquid, or solid that you're going to expel on the dance floor, doing an electric slide,
Right.
all these kind of things, or in some place in a theater, you know, you might have to get up, but you won't take the chance of sitting in that chair
Right.
and not knowing what's going to happen, you know.
There's no question that the rectum is very sensitive, but of course the vagina is very sensitive
Surely,
also.
that's what I'm saying.
So I think that men should be willing to allow to have a brief rectal examination done, because examination of the shape and size of the prostate can only be done accurately by palpation. And that means putting the doctor or the clinician puts a single finger, into the rectum and does a brief examination, feeling the posterior lobes, of the prostate. And by doing that, the doctor can estimate the size of the prostate, as well as look for any potential nodules or growths or irregularities that might signal prostate cancer.
Well, you know, going to medical school and even in my residency, I never had a doctor to say, what's the best way to do a rectal examination which not to be uncomfortable. And if I have found, even if this is the rectum, for example, the rectum right here, prostate lies behind here. If the doctor places his finger at that rectal opening and just relax the muscle in here as such, and goes in gently and be able to feel that gland on that side and come out. There's no pain should be associated with. There should be no embarrassment. There should be no anxiety, because you can't go in like this. And the doctors are unbelievable. I've seen it in emergency rooms. Doctors out there, please take note. Very gently place and let the rectum get accustomed to what's coming, not to surprise it. The rectum does not like to be surprised, but if you go in there gently, you can feel the prostate gland. And this is very important, because if this is keeping you from having a prostate examination, you can go to the doctor and show him exactly what you've seen on this television show right now about the rectum and how he should be doing the examination. And I think that will kind of take that.
Right. Also, the doctor should tell the patient what he or she is going to do.
Yes, right, sure.
And say, I'm not going to shock you, I'm not going to surprise you with anything. Let's take one step at a time. So first I'm putting my gloves on, and I'm going to use my lubricated finger. And we're just going to slowly go into the rectum.
There you go.
If you're feeling any pain, please tell me
right away.
and I'll withdraw immediately.
That's right.
So the atmosphere in which it is done is also extremely important.
Surely.
But a good screening of the prostate involves this rectal exam to look at the prostate, asking some questions about prostatic size based on how the man is urinating.
Yes, surely.
And then also, it used to be to do a PSA, which is this prostate-specific antigen blood test.
Right, surely.
Recently, some of the developers of the test have demonstrated that a single test and just measuring against a single marker may not be that useful.
That's right.
Because men can have prostate cancer even if their PSA is very low.
That's right, surely.
And men can have very high PSAs because their prostates are big,
surely.
but not cancerous.
Not cancerous.
So a single blood test is turning out to be less of an indicator than we anticipated.
Right, surely.
So you need to discuss with your clinician. A series of PSAs, however, can be useful because changes in the PSA value seem to be more important than just a single test.
Well, and more and important also, because the PSA is a little elevated, to go in and do biopsies of the prostate. That, to me, is something uncalled for from the standpoint, unless you have a very definite lesion you're feeling. But to go and puncture that prostate gland, and men have had this done and have been out of there.
Sure, they've actually had problems with sexual function. They've had urinary tract problems. They've had pain. They've developed infections, and there've been some mortalities from septic situations that have occurred following a prostate biopsy. So you do have to think twice about that. But we're also frightened of prostate cancer, maybe needlessly, because a lot of prostate cancer will grow very slowly, and men will more likely die from some other cause
That's right, sure.
other than the prostate cancer.
Sure.
So the best thing to do, in my estimation, would be to discuss with your doctor what the meaning of the PSA is
Sure.
in his or her mind,
Right.
and what advice they would give you if the test turns out to be positive or negative.
Surely, surely.
If you have an intelligent caregiver who's up to date,
Right, up to date.
then the caregiver will help you evaluate the meaning of a single value,
Surely.
and then perhaps work with you to establish a series of values annually
Right, surely.
over the next 5 to 10 years.
Sure.
You know, some doctors are saying it might even be worth having a PSA when you're 35.
Right, surely. Mm-hmm.
And then you test it again when you're 40, and again when
Okay.
you're 45, and then when you're 50, and then maybe a little more frequently.
Right.
And you're not using the absolute value anymore.
That's
that
right.
doesn't have any meaning. It's the change called the prostate velocity,
That's right, sure.
or the
Of course.
PSA velocity.
Velocity,
that
surely.
seems to be the important factor.
Right.
So a prostate screen means using the finger to do a digital exam,
Surely.
discussing with your doctor about whether or not you want to have a blood test,
Right, surely.
and some type of screening to get an idea whether the prostate is causing unpleasant symptoms.
Right. And if you say 70, 75, and you're urinating all right, you're not getting up at night and things like this, and urgency and things, even to do a rectal examination might not be significant. I mean, at the age of 70, 75 years old.
Right, I think that's true. And a lot of doctors rationalize doing a rectal exam because they say, I'm going to get some stool and test it for blood.
Yeah, right.
And we found that that's not a good way to obtain stool for hidden blood.
That's right,
And the
surely.
reason is when you put your finger in there, you're going to traumatize some small blood vessels.
Oh, yes.
The man may bleed a little bit. So if the doctor really wants to test stool for blood,
Yeah.
you should give the patient cards. They
Surely.
should take those cards home,
Surely.
and the patient should use stool that comes out of the bowel normally.
That's right.
Put it on the cards,
Sure.
and then that should be tested for blood.
Surely.
So digital exams, except in the emergency room,
Of course.
are not appropriate
Right.
for doing hidden blood testing.
Of course. Well, even if you have some urinary obstruction, for example, going into an emergency room where it's not the best place to put a Foley catheter in,
Right.
to put a catheter through the penis as such, into the bladder and things like this. These are all traumatizing things to a person who is not being done well. I mean,
Sure.
the doctor who's doing it.
Sure, but if the prostate gets too big,
Yeah, sure.
this is a possibility.
Sure.
If a man's taking testosterone and he already has an enlarged prostate,
Yeah, sure.
then prostatic obstruction of the urethra is certainly a possibility, and the urine will just cut off.
Right, sure.
Fortunately, we do have some medications. We have medications that over a long term will shrink the prostate.
Name some of those, the plant
Okay.
ones.
Yeah, those would
particularly.
be finasteride and dutasteride.
Okay.
These are
Give the-
5-alpha reductase inhibitors, are the fancy names.
All right.
And they prevent the conversion of testosterone to dihydrotestosterone,
Okay, sure.
which is a more potent enlarger of the prostate.
Right, surely.
So by taking these medications, you prevent further enlargement of the
Right,
prostate
surely.
and actually get some shrinkage.
That's right, yes. But what's the trade name?
Those would be Proscar
All right.
and
Proscott.
Proscar is the most
The
common
most common
used
one, yes, surely. And it does the job.
Right,
You
it
know what I
certainly
mean?
does.
Sure.
And there's another family of medications that can be used for the symptoms, which are called alpha blockers.
Right.
Things like tamsulosin or Flomax.
Okay,
you
yeah,
know,
surely.
is the most commonly used one.
Right.
And these help to relax smooth muscle around the urethra, letting the urethra dilate a little bit and allowing the urine to flow
Yes.
a little more smoothly.
Right.
So we do have some medications now, and actually, one of the medicines that was previously approved for erections is now approved for the management of benign prostatic hypertrophy,
Okay.
specifically tadalafil, known as Cialis,
Oh, yes, Cialis.
can now help to shrink the prostate and reduce prostate symptoms.
In fact, I was sitting around a lunch table one time and they were talking about this. And I told them if they have some sexual problems, they should see Alice.
Right. Well, that's what the name is.
When I see Alice,
Not spelt the same. But
wait. But the whole thing is that certainly sexual function and dysfunction are one of the major men's problems as
Right.
they get older. And I think this discussion today at least allows our audience to understand just a little bit more when they go to the doctor to question these kind of things that we mentioned, how you should take a rectal examination trying to feel the prostate or whether you should have it or what
Right.
have you.
And I think that's true. And I think when you're a physician or a clinician and you're sitting face to face with the man tells you his problems, tells you what he wants solved.
Right.
But you should take a little bit of extra time to explore a little deeper.
Oh, yeah.
Find out what else is going on with this man. Find out about the rest of his health. Men don't ask many questions.
That's right.
So we miss out on an opportunity to educate them.
Right.
So we have to be proactive. We have to educate men.
Well, I tell you, one who does educate men is the wives. Wives are the best ones to find out what's going on with their husband and bring them to the doctor. A wife will ask more questions when she sits in with the doctor that's after examination, and I think the wife should be in that office at that time.
Right, I think that's true. And you may remember about 3 years ago, the New York City Health and Hospital Corporation advertising campaign about bringing your male person in your family to the office. And they show a family carrying a chair on their shoulders with the man sitting in the chair through the front of the hospital.
Well, I hope we don't have to sit on that chair. But anyhow, this is Dr. Deas. We'll see you the next time, and hopefully you'll learn a lot about the prostate.